Hello, this video is to show you how to use templates in eClinicalWorks. Let's open up the test patient. The progress note window appears, and templates can be accessed through the bottom toolbar by clicking the Templates button. Now all a template is a guide that goes over or pulls in information that should be covered during a particular visit, or information that you find yourself typing over again and again. There's lots of tools in ECW that allows you to add repetitive information, and templates is just one of them. A template can encompass the entire SOAP note, except for histories or current medications that should be specific to a patient. Or it could just be one section. I could create a template just on an HBI, or just on an exam, or just on education or instructions that I'm going to pull into my treatment. Now in this Copy and Merge Templates window, it tells me which patient I'm using this template on and the encounter date. And there are two types of templates, generic and patient-specific. Patient-specific won't be covered in this video, but I can take a previous visit and pull it into today's visit and use all or a portion of that visit in the note for today, updating the information that's changed. The generic template are templates that are created by a user, by the practice, or by a site. If I go over to the category window, which now says all, and that's the default setting for all new users, I can click the drop down arrow, and different categories include different services like medical and behavioral health, different roles like nursing or medical assistant, or different reasons for templates like well child templates or complex care management, or site-specific templates like we have here for Hartford. When I pull that category in for Hartford, down below, I see all the templates that have been associated with that particular category. It starts with the blank template and goes down to 12 months. This isn't the only window of templates. Down below at the bottom right, I have a Next button, which is available, and that tells me that there's something more to see, as opposed to the previous, which is grayed out. So if I click Next, it takes me to the last template, which is weight check for newborn. Going back and clicking on Previous this time, I'm back to that first page. Now if I want to preview a template like the newborn, I can go over to the Preview Template icon, open up the window, and I can see what this template encompasses. So I have a chief complaint, an HBI section, review of systems, social history, examination, assessment, and preventive medicine. Now there's some portions that I'm looking at that will not be pulled into my template when I merge it, like the patient's name. T-templates is a generic name or patient that we use to edit or create templates. So the name, the date of birth, that date will not be pulled in to our progress note. Similar, the phone and the address won't be pulled in either. Now there's also another section, medication, that I'm not going to check so that it doesn't pull into my note. But I do have a social history, so that I do want to make sure. Now remember what I said, a template is a guideline. So the reason why I am going to put on this social history, because I'm going to need to capture who lives at home, current child care arrangements, and coping and self-care. If I go up to the HBI, in this list for newborn, I have things like location of prenatal care, and it has a default answer, WAHS. And that's because a lot of the patients that are seen at Hartford go to this facility for their prenatal care, as well as being delivered at Hartford Hospital. But if I go down to gestational age and birth certificates, I sort of have a default answer, but I need the values. So for gestational age, I need the weeks and the days. And for the birth statistics, I need the weight, the length, the head circumference, the discharge weight. All of those things need to be captured. And it's telling me that I need to capture with those asterisks. Now if I close this window, I can look over on the right side, and I have some boxes already checked. Now these are the corresponding sections of my progress note over here. So I have a chief complaint, I have an HBI, review of systems, examination, those boxes are already checked. Now the reason they're checked is because the provider that this appointment is under has a default set so that only these boxes are checked by default. When you open up your templates window, your copy and merge templates window, you may or may not see the same items checked. It depends on who owns the note, and they can set up default options. Later, I'll talk about that. Now, if I don't want something in the template, I have to uncheck the box. So by unchecking Chief Complaint, and remember if I preview it, there was a section here for Chief Complaint. When I merge this section will not show up in my progress note over here. I do want that, so I'm going to check that. I also want social history. I don't need a treatment because that's not part of my template, nor do I need labs, but I need preventive medicine. And I'm going to uncheck visit code and procedure codes. Now that I have the things checked that I need, I'm going to go to Merge Template, click that button, and I get a sentence just above it that says that this template was successfully merged. There is no pop-up button or window. There's also no audio sound that tells me that it was successfully merged. I just have to read the statement. I'm going to close this window, and now I can get a better look at my template and my actual progress note. So there's the Chief Complaint, the HBI section, social history, review of systems, examination, assessment, and the preventive medicine. When I scroll back up, I can begin my documentation. Now, a lot of our clinics have a workflow where their medical assistants or the LPNs or nurses might go ahead and merge that template in for the provider who's seeing the patient. So don't be surprised when you open up your note. This usually just happens with well childs, that you already have a well child there. That Chief Complaint tells the team members that depression screening for the mother needs to be done, that somebody needs to check to see if they have the Hep B for their birth dose, and also to review the discharge record and complete the social history. So that rather than being actual complaints of what's going on with that patient, they're telling the team things that need to be done for this particular visit. Remember what I said, a template is a guide of what should be covered during the visit. Now, if I want to add to that Chief Complaint, because the mother informed us that this child has a fever, I can simply go over to the Chief Complaints link, add a row, and type in whatever that Chief Complaint happens to be. So I've added the fever, closed the window, and now I've got the Chief Complaint, fever, added. So just because it's not on your template doesn't mean you can't add to it. As a matter of fact, the templates, most templates, you do have to update that patient-specific information. So that is how you can update the Chief Complaint. If I go down to the HPI is where you can really test the functionality of how the template works. Now, when I take my mouse and I hover it over the HPI link, you can see that the mouse turns to a hand, as well as Hartford Well Child, the purple font, the green font that says newborn, and then the black font, all of this changes to a hand. Now, if I move my mouse over outside of the template, I no longer have that hand that tells me that I have a clickable item or a hyperlink. So that means that I can click on either the blue font, the purple font, the category heading, the newborn, the actual age group, or any of the information in black font to document my template. So I'll show you how each one of those works. If I go to the HBI link and click on it, I get the HBI window. I have categories on the left-hand side, so I can go into different areas. One of the things I said is that the patient has a fever, so I can click the little plus next to journal complaints and go down to where it says fever and make my selection, and it adds to my note. So I do have that option. And when I close the window, I will have under Hartford Well Child fever down here. All right, so using the HPI link itself not only gives you your template items, but it also gives you access to all the other categories that are available. Now I'm going to get rid of that by just clicking the X on the same row as fever on the right side. And when I close the window and scroll down, fever is not there. Fever was not added to my template, it was just added to my note for today. Now going back into the HPI, the Hartford Well Child shows up. That's that purple category. And then we have newborn, which is green. And then we have the notes, okay, which are the black fonts. So those colors, obviously, in this window, they're all black. But if you look back over here at the template, you see the Hartford Well Child is purple, the newborn is green, and then the location and everything else under newborn is black. So purple, green, and black fonts. Purple, green, and black fonts. All right. Now also under Hartford Well Child, we have the different age groups. And if I were to have loaded the 1 month or 2 month or 6 month template, we would see that they would have their own note section. But they're not in this template, so they're blank. The S that you see to the left of each of those items stands for structured, and that means that we are collecting data. So it's reportable data the way that you're inputting your answers. So we can run a report if we need to. If I click in the notes for newborn, I'll get that list of all the items that are underneath newborn here in this main window now. And you can see the default answers: Hartford Hospital, WAHS, NSVD for delivery issues, difficulties feeding, no. So these are the normal answers, or the common answers that are documented on a daily basis. Gestational age, if I go over to the notes, we can see those weeks and those days with those asterisks that are prompting us to put information in here, values in here. So it's making us document in a very particular way. Now if I start with location of prenatal care, maybe the patient did not get their prenatal care here. So I can click in the value field and I'll get a drop down arrow. And let's say that this particular patient was at Middletown Prenatal. Okay. And if I want to say something more specific about that, maybe they started going there in the 2nd trimester, then I can go ahead and type that in and click OK. I'll put the delivery. And those additional notes have now been added. So that's free text that I just typed in, as opposed to picking from a pick list drop down for very specific items. So I have a pick list or a drop down, and then in the notes I can add free text. For pregnancy complications, let's say that they actually had some. So I'm going to uncheck none and choose other. I can also add, so this time instead of just being able to pick one answer, I can do a multi-select if I need to. But I'm just going to add other and go into the free text again. I'll clear that and then go ahead and type in what those complications are. Mild bleeding during 1st trimester. And then click OK. And close the window. And whatever changes I've made when I close the HBI window are going to show up here in my progress note. So under location of prenatal care, here's my Middletown Prenatal, 2nd trimester to delivery, location of delivery, Hartford Hospital, I didn't change that, and then pregnancy complications, other, mild bleeding during 1st trimester. So once again, that was using the blue hyperlink HBI. If I close this window and I click on the purple hyperlink for Hartford Well Child, well, I get the same window. And the documentation is very similar. I can click in the notes and make whatever changes I need to. This time, let's say maternal substance abuse. It is prescription. Okay, I'm going to go ahead and add that and then update my notes to say that the mother admits to using oxycodone for backache during pregnancy. And then I click OK, and that's been added. When I close the window and close the main window, once again, whatever additions I've made now show up. Now, moving on to the green font. I'm going to click on newborn here. And this time, I didn't get the general HPI window, which gives me the categories. It went straight to the notes section for newborn, the structured notes section. So in this window, I can just go down through my list once again and put in the information that I need to. So for delivery issues, complications, I'm going to change it to C-section and click Add. And for the gestational age, I'm going to skip the value field and go straight to the notes and highlight the asterisk to add that additional information. And I'll put 38 weeks, and I'll put 5 days, and click OK. And now that's been updated. When I close this window, those changes show in my note itself. So the green font takes you directly to the items that are underneath the category heading for Hartford Well Child. So we're in the item newborn, and these are the options for newborn. The only way that I could add the fever from this screen would be to close the window and either click on Hartford Well or the HBI to bring me back to this window, so I can now have access to these categories on the left-hand side. Now, of course, if I need to, I can probably down here under current concerns include add the fever as well. All right, so let me show you how that works. So this is using the black font. So if I click on that hyperlink current concerns, my window looks different. It starts me with location of prenatal care. This is just the way that this was designed. But now if I scroll down, it's taking me through all of those items. Maternal substance abuse. Here's where I typed the mother admits to using oxycodone. But the window looks different. So the fields are still the same. The look of the window has changed. And I'll need to scroll all the way down. Here's my current concerns. And I can type here fever, and then I can also put in what it is if there was a fever today. And click OK. And type in anything else I want to, and click OK down at the bottom, and now it's here. So that's also important. You don't have to go from top to bottom when you're doing your documentation. I can go to any section of the template or the progress note to enter my information or make my changes. Remember, this is just a guideline. It's helping you to remember what you've got to document for a newborn. Now I'll do the black font one more time. I'll go into birth statistics. Once again, when I click on it, I have to scroll down until I get down to the birth certificates. And here it is, birth weight. Remember, I'm going in, highlighting those asterisks or that space so that I can put in the information that I need to. Birth length. Now remember, the template told you in order for you to get that information, you needed to get the discharge record. That was a part of the template as a reminder, and now you know why, because you're going to need to be able to input some of that information in your note itself. And I click OK, and I'm going to click OK down here, and once again that new information has been added. Let me go down a little bit further. Here's social history. Okay. And when I move my mouse over that section, Hartford Social Screening, that's not clickable, but Who Lives at Home is, as well as current child arrangements and parental coping and self-care. So this is a tip for you and sort of a caution. Just don't assume that because the font is black, it's a clickable link. That mouse is going to tell you whether or not it's clickable. So Who Lives at Home, I'm going to click there, and this is free text. So once again, I'm just going to type in, I'll just put mother and grandmother, and then click OK. So now that's updated, and I've got Who Lives at Home. If I use the blue hyperlink in this case for social history, it opens up all the options for social history. So for the newborn, this is the minimum that I need to collect. But I do have other options within social history. So if I want to put in caffeines, pets, maybe they live with a cat. So I'm going to go ahead and click in the details to open up this window. I'll timestamp it, choose a cat. I'll put 3 cats and click OK. So the blue hyperlink always gives you all of the availability, all of the choices that are under that section, not just what's on the template. If I scroll back up, the Hartford Social Screening, I click on that. And in addition to the Who Lives at Home, current child care, parents coping and self-care, I also could enter my Edinburgh score, concerns regarding behavior, etc. So these are additional items that I could add to my note. So the black font, when it is a hyperlink, it just is going to take you to what's exactly on the template. Whereas going into the green font or the blue font or purple is going to take you into all of the available options. I'm going to close this window and close here, and go over a couple more sections with you. So under Review of Systems, we have the blue Review of Systems, which when I click on it, I get the categories on the left-hand side. If I click on the heading for pediatrics, I just go to that category, and then I have my +4 and -4. Or if I click directly on the green font, it just brings me to +4. And I'm going to clear this. Put decrease in stools. Now, this time, I could click OK, but I have the next available to me. Paying attention to the next button in multiple screens can be very helpful with getting through your documentation quickly. So I click on next, and that's -4. And I'll put -4 decrease in feeding. And I'm going to go ahead and click OK. Now I have +4 decrease in stools and -4 decrease in feedings listed here. The pediatric exam, you have your examination link, your purple pediatric exam, and then your green fonts and your black fonts. So you have the items of what we're trying to capture, and then the default answers are in black. So let's say that the general appearance is not how I would like to write it up. So now I have to decide, which font do I want to click on? So once again, the green font gives you the options, the free text box. If I click next, I can go through all of the items. The very first next option was skin. Now notice skin is not here in my list. So this is an additional item that I could document in. So if I choose normal and click OK, that is now part of my note. All right. If I click on the black font, it is only going to take me to what's actually in the template itself. So very similar to the social history, when we clicked on the black font, We only went to what's in the template. Now normal skin is a part of it. If I go to next, there's head, there's eyes, there's ears, and I can make whatever changes I need to. In this window, the box that you see here allows you to make multiple selections, whereas the circle only allows you to make one selection and it closes the window. Okay, so green font, it takes you to all the possible items, whether or not they're on the template or not. The black font is only taking you from this to each black default answer to what's already on the template. And then the purple category heading shows you everything. All right, so after chest, breast is blank, so breast is not on our template. To show you guys the green font again, how it works, if I click on chest and I click next, I'm going to go to breast. But if I use the black font for chest and I click next, it's going to skip over and take me to heart. There is no wrong way or right way for you to document your or to use the functionality of how the template works. I always say that it's your way. You have to decide which font, which window you like to look at. Some people like to know what all their options are, so they'll use the blue link, the purple link, or the green font. But others want to just stick to what they're being told to document, and so they use the black font. Now there's a couple more things that I wanted to point out to you. Let's say that there were some issues, some concerns that came up on this visit. So under assessments, this assessment is not going to work for you. So I'll go ahead and open it up. And I can remove the current assessment there and search for the other assessment. I'll just put a couple of keywords in this search field and click go. And then use my search to go through the list. And if I don't find it right away, then I can adjust my search. Okay, so I have encounter for well child exam with abnormal findings. I can select that and it's added to the bottom, and when I close the window, it's updated. So you want to be careful when you have a template that has an assessment already added for you. It's very important that you make sure before you finish your note that that's the correct assessment. The last portion of my note is preventive medicine. When I come down here, the black fonts for anticipatory guidance, there are no hyperlinks. So for this one, I have to go all the way into preventive medicine and then find my category for anticipatory guidance. And here's newborn. And go into the notes and either use the pick list over here or free text as well to add to that list. When I close the window, everything that I've selected is going to show here in my note. So those are the basics of using a template. Remember, template's a guideline, so you'll have some things in your template that are just telling the users what they need to do. And you'll have portions of the template that give you the information of what you need to capture. You can either use the blue hyperlinks to go into the full window to see all your options, as well as the purple and green, or you can stick with the black hyperlinks and they will take you to the items that are specifically in your template and nothing else. One last thing before we finish. I advised you earlier on that when you click in the templates, you have these boxes here that are already checked, and they're based on the owner of the note, which if you're a resident is going to be the credentialed provider, the supervisor, preceptor that you're working with, or if you're a nurse, it could be the PCP. So if you are a credentialed provider, you have the ability to go under the drop-down arrow for templates and choose Set Default Options. And you can decide that, well, I'm always having to check social history, so I'm going to go ahead and save that as my default option. And the next time that I come in here, those are the options that will be checked, as in social history here. But for those of you who are resources, please remember that these options aren't your defaults, unfortunately. They're the defaults of that credentialed provider. Now, if I would like to add these templates to my favorites so that I don't have to come in here every time to make changes, and by the way, the category sticks, but I might find myself searching every once in a while and looking at all the templates. But what I can do is I can add each template that I'd like to keep that I find to my favorites by simply selecting it and choosing Add as Favorite. And that way I'm not just stuck with one category. I can search all throughout. But you just have to remember that it's my favorites that I'll be looking at, not favorites. Okay, so my favorite is specific to the user that's logged in. But I can do that with any of the templates that are visible for me to see. You decide. It's very easy to come in here and just change the category, or you can create your favorites, as I said. Now there's one more common mistake. Let's say that I accidentally loaded a template twice. There's just one click that has to happen here. And a lot of times individuals think that they have to double click because from application to application, and even in eClinical works, it's not consistent. Sometimes we have to single click to open up a window, sometimes we'll double click to open up a window. Okay? However many times you click this merge template though, when I close the window, that's how many times the template has been added to my progress note. But I can fix that relatively easily. If I go back into templates, there is one thing you'll need to remember. If you've already started to add answers, this fix will remove those answers. So if you've done the majority of your note, I would suggest you go ahead and print out this progress note so that at least you can quickly get that information back in. And it's not super quick, but at least you won't lose that information. So now I'm going to go back into templates. I'm going to select that newborn again, and I'm going to make sure that the boxes that I need to, or the sections of the template that I need to fix are all checked over here. Now once I've done that, anything that I don't want checked, I need to make sure I uncheck them. And instead of merging, because merge adds to what's already there, I'm going to click the drop down arrow and use Copy Template. Now I get this window and it says this action will overwrite any existing information currently documented in the specified sections of the note. I need to point out to everybody that the specified sections means that whatever box that I have checked over here, it's going to overwrite those sections. So am I sure? Yes, in this case I am. So I click yes. And now I've got a clean slate for the sections that I made sure that I checked. Okay? So that's how I can fix my template. That's all I wanted to show you for how to use a template in ECW. Please feel free to watch the other videos on different areas of using eClinicalWorks. Thank you.